Today we're diving into one of the most asked questions I get on my channel. How do you transition from bedside nursing into utilization management? And how do you nail the interview once you get there? In this video, we're going to cover the following: why nursing might be the right fit for you, how to build the right experience to land a utilization management nursing role, how to set up your resume the right way, some sample interview questions, and some final tips to just give you a confidence boost. If you're new here, I'm Steph J, and I believe in exposing nurses to soft life nursing and remote nurse roles. So let's get into it. Why should you consider nursing? Nursing roles offer flexibility that bedside might not give you. You'll have better schedule predictability, and you'll have the option to either work hybrid or completely remote. This is your chance to use your clinical skills to help the overall institution that you work for. The entire goal of being a nurse is to ensure that the patients get the right kind of care. This role is a meaningful and strategic move in your nursing career, so don't let anybody talk to you different because you don't want to break your back bedside anymore. Now, how do you prep to shift from bedside nursing into nursing? You start by identifying your transferable skills, your clinical judgment, your documentation finesse, and your knack for interdisciplinary discussion and collaboration. If possible, look up case management or discharge planner roles. You might be lucky like me and find a and CM combination role. While it is a lot of work, that role is what truly opened the door for me to work completely remote in a role. The discharge planner and case management roles prime you to be a great utilization care manager and show hiring managers that you're familiar with utilization criteria. I would suggest that you look up tools that nurses use on a daily basis, like Interqual, MCG, or Milliman, depending on your institution. When I was a case manager, I had to use medical coding whenever I would order DME for a patient. So that role really got those codes in my head when I was trying to get certain hospital stays to meet for criteria, or when I was trying to get the patient to go home with something. Codes that you should look into are ICD-10, DRGs, and CPT. If you can speak to any of those three or throw those in during an interview, I guarantee you're going to make an impression, especially not having that experience. Now let's break down your resume. You need to start with a strong summary or objective. For example, you can use something like this: registered nurse with 5+ years in acute experience in evaluating care needs and coordinating patient-centered plans. Currently seeking utilization management opportunities. Then you can go on to highlight other transferable skills that all nurses really have: clinical decision-making, documentation precision, payer collaboration, and cost-effective practices. Make sure that you're using active verbs. Here are a few that I used on my resume: evaluated, coordinated, advocated, documented, streamlined. Tie your work to clear results. In other words, what did you do? For me, that was reducing readmission rates. I would do that by making sure that the patient went home with home health, they had transportation set up for their follow-up appointments, and we had a SNF on standby, aka a skilled nursing center on standby that the patient could potentially go into and be accepted into if they discuss with their family and they just realize, you know what, I don't think I can handle this at home, but we can send them to a short-term rehab facility so they can get stronger and go home without the chance of them coming back to the hospital and readmitting through the ED. If you have your certified case management certification, don't forget to throw that in there as well. Now for the interview. Hiring managers are looking for clinical savvy and the ability to think critically. They also want to know if you have any history or knowledge of working with managed care, Medicaid, or any specific insurance policy. You'll also have to be a great communicator. You're going to be the nurse evaluating certain clinical documentation, and if you work from the hospital side, sometimes you're going to have to talk to your doctor and let them know, hey, this is not going to meet for criteria because X, Y, and Z are missing from your notes, and these certain medications are missing from your notes, or certain therapy notes are missing from the notes of the day. So you need to make sure that when you go to interdisciplinary rounds that you're able to explain why they need to document things a certain way in order to get things approved. Think of yourself as being the link in the chain. You have all the knowledge, and sometimes you got to tell the players what to do. I've also had experience doing utilization management for an insurance company where the hospital submits the paperwork to us, and then we determine whether or not that clinical stay is going to meet. So documentation is super important, whether you're on the front end of it or the back end of it. Let's get into a few sample interview questions. The first one is, how do you assess medical necessity? For this, you're going to want to lead with a clinical example, reference guidelines, and a focus on balancing need versus benefit of the service. Another question is, tell me about a time you advocated for a denied claim. Share a specific story, actions you took, and the outcome. If you're going after a role in denials or appeals, the hiring manager is going to want to know how you handled that situation and basically tease through what you could have done better if it did not get approved. The next question is, how do you handle multiple reviews? Now, this is kind of like a trick question because if you've ever worked in utilization management, you have a queue and you have to complete a certain amount of reviews every single day. So you're going to be doing multiple reviews every single day, sometimes two at the same time. That's just the reality. When you answer this question, make sure that you're emphasizing time management and organization. Talk about how you're going to triage urgent cases, document thoroughly and check your notes twice, and keeping your deadlines tight so that you can make sure that your turnaround times are succinct. Utilization management lives off of turnaround times. You have to make sure that your turnaround times are within range. Every institution is different. Every state has their own guidelines, so just check with that. It's always a good idea to go into interviews preparing stories in advance. It just makes things seamless, flowing, and you're not tripping over your words. Now, if you want to go above and beyond, make sure that you're utilizing the STAR method. When you're asked a question, use the STAR method to formulate your responses. The STAR method is S for situation, T for task, A for action, and R for result. I got you. Now, here are some final tips to use while you're searching for a role. On your resume, make sure that you're taking the job posting and mirroring it your resume. On your resume, always tailor each and every one to the job that you're applying to. It's a lot of work, but how bad do you want that role? Make sure that you're taking the keywords from the job posting and placing them into your resume. Don't lie, but make it work for you, if you know what I mean. Quantify outcomes where you can. This is your chance to show off. So do it. On your interview, make sure that you're asking great questions. One question that I always ask during an interview is, what medical necessity tools are you guys using at this institution? Another question is, what is your review volume like? There are certain locations where you can get a queue of 20 per day. And then there are institutions where you're stuck in the queue all day. And then there are other institutions where you need to do 50. You need to know what you're getting into. I know you want to get out of bedside, but you don't want to go from one terrible situation to one that's worse. So just be real with yourself, what you can handle and what you want to do. The last thing is something that I did not do, but I feel like it's popular these days. Some people say to share your story on LinkedIn and just talk about how you're trying to break into the utilization management space. You never know when a recruiter or hiring manager is watching. So again, put yourself out there. Remember that you have real clinical experience and that matters. Leverage that to advocate, analyze, and add value to the role that you're applying for. If this helped, make sure to like this video, subscribe to my channel for more nursing content and soft life nursing roles. Drop a comment down below about your role nursing experiences or your frustrations about getting a nursing role, or any issues that you had during your last interview. Let me know what role you want to know about next, or if you want to deep dive in certain certifications in nursing that'll help you level up in your career. Please believe that you got this and you will break into utilization management nursing. Your bedside nursing experience is the very thing that's going to help you pivot into the next step of your nursing career. Thank you so much for watching. I'll see you in my next one. Bye.
It was all a dream, just a new girl on the scene. Got your face on magazines. How it feels,